Hey, Dr. Brett here. Just kind of casual today, but I wanted to debut my new microphone to make better quality videos. And is what I want to talk to you about today is the nature of symptoms. So we be talking about any symptom in the body, whether that's pain, fever, if you're not sleeping well, your bowel movements are fast or slow, runny nose, cough, whatever. Okay, symptoms. So I think of symptoms as the language of the body. And I want to be able to hear what the body is trying to tell me. So using a medication to suppress a symptom, to me, is totally backward thinking. There might be a time and a place for that. But to me, it's. I'm going to make an example. It's like you have a friend or a loved one, someone you really care about, and they have a situation or something going on. They come to talk to you about it, and they're really needing some help. And you're just like, shut up, I don't want to hear about it. You're like, but well, I have this thing going on. I'm like, yeah, I don't want to deal with that. That's what you're doing with a medication. When you take a cough suppressant, when you take ibuprofen or something to suppress a fever, when you take medication to eliminate pain. And by the way, it's not just medications. You can use plants in this way, or I'm thinking specifically of marijuana. Everyone thinks of, or there's a big push for marijuana right now, and I see that it just suppresses symptoms. I don't see it as curative at all. So every one of these symptoms is trying to tell you something. It's the body asking for help or asking for a correction, I would say. And sometimes that might be as simple as, if you've got scurvy, your teeth are falling out, and this is what happened to, back in the day, if you were a sailor or something. You had scurvy, your teeth are falling out, and your wounds aren't healing, and it's a connective tissue condition. The correction that's asking for is simply to take vitamin C. Okay, so they started bringing limes on the ships, and they would eat the limes, and they called sailors limeys because of that. Okay, so, or it might be you've got some pain in a joint. Well, that joint might need, that the structure might be malaligned. You might have to adjust the bones. You might have muscles that aren't firing properly. You might need to do some exercise for that, or a lot of times joint problems is dehydration. Okay, so when you suppress these symptoms, you're going to miss out on the huge gift that is the message that symptom has for you. And I know we don't really like symptoms, and so we just want to shut them up. We want to suppress them. But you're going to miss out on what that's trying to tell you. Now, a bigger issue with this is it's like with your car. If the gas light goes on and you just want to shut it up, maybe you cover it up with something so you don't have to deal with it, well, then you're going to be running into a bigger problem of running out of gas, right? So it's definitely better to take care of your symptoms early on. And we've even started saying in my circle that there's no such thing as a small symptom. So you want to take care of your symptoms the best you can your diet and lifestyle, of course. You know, I have all my patients supplement that. You want to get to the bottom of what's going on, so whether you do that yourself or you need the help of a professional, don't just let them go. Don't suppress them, okay? So I would say suppressing's worse than just letting them go even. Let it bother you. Let it push you till you want to do something about it, okay? And take care of yourself. So I'd love to hear any discussion that you have about this, so leave anything in the comments and we'll talk about it. Cheers.